So what do you feel is necessary for a person to stay well in this area? Do you expect all your patients or people that have problems to be in an exercise program or just on their own?
If everybody who left my office ate better and exercised, I did a good job. I don't care what your problem is. Diet and exercise are huge and always will be. As far as the spine goes, we make sure through various means, traction, manipulation, keep inflammation down to a minimum, make sure that part of your body is functioning well. But like Adam said, we do other parts of the body. We do a lot of nutrition here because that's really important. And so I think maybe because you're saying the difference, maybe an advantage of a chiropractor, of course I'm biased because I'm a chiropractor, is, one, our training is very large with diagnostics. So we diagnose you, use MRIs, x-rays, whatever we need to find out the core of the problem, and then address the problem and not just the symptoms. And then also an advantage would be the nutrition aspect, which I don't know how much physical therapists have in nutrition, so I guess I shouldn't speak for them. But yeah. So, yep.
What, in your mind, in your estimation, do you feel like, is it an ongoing thing? A person comes and you do some manipulation. Say they come in and they're really in pain and they're bent over and they can't even stand up. And they come in here to see you. Now, is that going to end in a few sessions or is it ongoing? Do they come in here for a year, 2 years later, or for the rest of their lives so that they can maintain?
I would like for people really to, to maintain for the rest of their life. And I think what I really like to do is to sort of be like a life coach, and I want them to bring their family in too, because I think this helps prevent further injuries and disease later on down the life. So, I always recommend that people stay with their care, and they have a choice whether they do or don't, but I recommend that they continue with chiropractic care.
Even though they're feeling better? And
yeah, because I don't base my treatment on the symptoms. Really.
Somebody comes in and they're really hurting, and after a few treatments, they feel, oh, gee, I feel great now. Right. And then you don't see them again until they're back in trouble again.
Well, yeah, that happens a lot, and I don't really base my treatment on their symptoms. People come in and they really want to feel better. That's the reason that they come in. But, you can have cancer for years and not feel it. And then when you get diagnosed, and it's the same thing with back problems. You can have something going on and not really feel it. And then by the time symptoms arrive, you've already have some damage. Mm-hmm. And I think I can prevent that, with regular checkups.
So are you saying then, like going to your internist, that if a person has no problems at all and they're fairly healthy, they should come to a chiropractor just for routine? Yearly, monthly? I'm not getting it.
It depends on the person. You can't base something always on pain. And if someone is 24 years old and they exercise and they're healthy, they're not going to need to go, obviously, as much as someone who is 50 and already has a degenerative spine. A lot of times I get that. It's like, well, I heard if you go to a chiropractor, you got to keep going. Well, if you have a chronic problem, yeah. If I help you, you do. Because you're not going to take one ibuprofen and never take another one. That's not going to work. You can't clean your teeth once and never clean them again. So whatever it is that we will do is only going to last so long. We live in a world of gravity, and it brings you down.
Yeah, I know.
And it affects your body. And so, you can't stop the aging process, but we can try to feel better and be healthier. And that's just a part of the overall health process. So.
Are there things that people can do, obviously, at home to keep themselves well so that they can prevent it from happening again, coming over completely stooped in big trouble?
Yeah, it depends on the problem, and this is really basic, but it's so true. If you have like a disc problem, for example, you have to avoid the activities that bother it. So if you're a big bowler, and every time you bowl, you throw your back out, well, guess what? Maybe you shouldn't do that anymore. The things that feel good and make it well, you do that more often. So if traction or certain exercises we prescribe, or certain supplements you take, or manipulation, if that helps you, we'll do that a lot to avoid the reoccurrence. And then, of course, both of us prescribe in core exercises. If you can remain strong, you're less likely to re-injure whether it's a knee or ankle, I don't care what it is, you got to be strong.
You talk about nutrition a lot. Does a person basically probably causes more problems if they're heavier? So if they lose the weight, that's going to relieve the problem.